Hi. So now let us discuss about limitations of anomaly scan, that is 18 to 22 week scan. We all know ultrasonography is a very useful screening tool, but the ability of detecting congenital anomaly will depend on so many factors. It will depend on gestational age when the scan is done, the gestational age when the structure develops, the bodily habitus. For example, if the woman is obese and the abdominal wall is thick, that is a limiting factor for better visualization of fetus. Also, if there is scar in the abdomen from previous cesarean section, that is also a limiting factor for better visualization of fetus. The fluid around the fetus, the fetal movements, all these factors are important. The position of the fetus is important. For example, spine is better visualized when the fetus is prone, and the face is better visualized when the fetus is supine. The man is important, that means the expertise and training of the person who is performing the sonography. The machine, that means the resolution of the sonography equipment is quite important. And one must follow the checklist or protocol laid down by ISCOG or FMF for better results. One must remember that sonography can never detect conditions like cerebral palsy or mental retardation or autism, because these are not the structural problems. Remember, the 18 to 22 weeks cannot detect conditions like microcephaly or hypospadias. It cannot, microcephaly means small size of the skull. This generally we appreciate in the further scans in the later on part of the pregnancy. Then there are certain anomalies which appear only late during pregnancy. Then how can we appreciate them at 18 to 22 weeks of scan? I will give you examples. Vein of Ganel aneurysm, cardiomyopathy, valvular stenosis means narrowing of the valves of the heart, coarctation of aorta. Some renal anomalies are difficult or may not be visible at this stage of gestation. Intestinal atresia, anal atresia may not be appreciated. Isolated cleft palate. Cleft palate is a soft structure inside the mouth, and if it is not present along with cleft lip, it is only isolated palate, one may not be able to see it. There is one condition called as atrial septal defect. Friends, remember, in normal fetal circulation, there is an aperture called as foramen ovale in the place of septum in between the two atria. So one cannot sometimes differentiate between foramen ovale and atrial septal defect during pregnancy at this stage of gestation. This anomalies can also may not detect small superficial cleft lip, some minor ear abnormalities, small ventricular septal defect, sometimes even congenital diaphragmatic hernia may not be appreciated during the scan. Hemivertebra, joint fingers or extra digit, extra finger may also be missed. Certain tumors of various sites that may not be visible. Also, remember, Down syndrome, many fetuses have normal structural findings and there may not be soft markers. So one may not detect Down syndrome purely based on 18 to 22 week scan. If you see my previous videos, I have already stressed the importance of anti-scan and NIPT for detection of Down syndrome and chromosomal abnormalities. They are more relevant or more significant than only 18 to 22 week scan.